Hello, my dear friends. Welcome to Aspire 32. And today's topic is really interesting, and it is about the career options after MDS surgery, oral surgery. I know many as a student, even I was very excited when it comes to oral surgery procedures. And today I have a young oral surgeon with lot of achievements. I have seen him grow from his post UG days and after his post graduation, and I have been following him. Welcome to Aspire 32, Dr. Varun Menon. It is amazing to have you on this podcast, and I'm sure the young viewers on my channel would be really inspired to listen to your journey and your guidance.
Thank you, Dr. Suresh. It's an honor to be here. You keep inspiring many young people. I'm lucky to be part of the inspiring podcast.
The pleasure is all mine, and I know that there are many questions, there are many doubts for any postgraduates once they finish the post graduation, or there are doubts for undergraduate students also, that which branch should you choose. And of course it is all destiny, but I would like to listen to your journey and your experience, so that whoever is interested in oral surgery, they will find some guidance. Although the journey can be different, nobody knows what their future holds for them. But Dr. Varun, obviously the first question I want you to answer is, why did you choose oral surgery as your post graduation?
As any undergraduate student, you have many dreams, especially after all the final year exams and when you enter the internship. It's like a golden era. And when you are working in a college where you don't have postgraduates, you get to do many things. Just like in endodontics, you are getting a free hand under the expert guidance on anterior RCTs, posterior RCTs. I liked endo. In maxillofacial surgery posting, I was lucky enough to get exposure to impactions and the joy of removing the broken root stem. And it's all a dream thing for a young intern. I'm sure many undergraduate students will have the same feeling. And once during the internship, I was lucky enough to reduce the dislocated TM joint. So as a young intern, it's all a dream thing. So my interest was either endodontics or maxillofacial surgery. But then there is one unexplored arena in undergraduate, that is orthodontics. So when you see orthodontics going through from one clinic to another clinic, and they have a lot of appointments waiting in queue, then the dilemma is whether to go with orthodontics. But destiny, as you said, or it's the fate. In Kerala entrance, I was lucky enough not to get orthodontics, not to get endodontics. Fate was, it is oral and maxillofacial surgery. As you say, it is destiny. I was lucky enough to do maxillofacial surgery under a good guide and a good institute. And that's how the journey ended up in me being a maxillofacial surgeon.
When you thought, okay, I have to do a post-graduation oral surgery, and you may be having a lot of colleges to select from, what do you think? Does the dental college in which you are doing an oral surgery, does it decide your future in oral surgery, or how important is a college in making a future for you as an oral surgeon?
A good oral surgery college, training should have good exposure to the cases. Be it trauma, be it pathology, be it oncology, be it reconstruction. If all colleges can't have everything. So say like, for example, X colleges have a certain like orthognathic surgery, more number of orthognathic surgery. You will be more experienced in that particular field. A certain college have more exposure to oncology. The training will be catering to oncology aspect. So different colleges will be specializing in particular area. Very rarely one college will be having all the different aspects of oral and maxillofacial surgery. So as a postgraduate, you need to have a wide vision. Take in all the knowledge that you can gain from that particular training program. Say like, for example, oral and maxillofacial surgeon goes for a periphery posting, be it in oncology, be it in clefts. So once you go and do the peripheral posting, you will broaden your expertise in that particular aspect. And say like you gain interest in oncology. After your residency program, you can always advance your training in oncology. Or say like if you are lacking in orthognathic surgery, you can do advanced training in orthognathic surgery. So I won't say like you choose one particular college, say like one college is better than other college. Every college maybe have its advantages and disadvantages. So what the candidate needs to look in is like whether they will have exposure to at least minimum aspects of oral and maxillofacial surgery, minimum number of cases, have a good attachment to medical colleges, and whether they will get a decent amount of hands-on experience. Say like you can read n number of things in the book. Very rarely you will get hands-on experience. That is what you need to look, whether that hands-on experience is there in your training program. If it is not there, then next option as a postgraduate student will be to, after your residency program, what other opportunities that you can do to get that hands-on training. Because ultimately at the end of the day, you need to have the skill to do that procedure. You will have so many, X will have that MDS oral and maxillofacial surgery. Y will have the MDS oral and maxillofacial. But if you don't have the skill and the knowledge to do that procedure, you're putting you are harming the patient. So that should not be happening.
As you mentioned correctly, we may not be 100% confident in every procedure, but what is important, as you mentioned, is to at least have that exposure, and maybe that is how you also get to know what you're passionate about in that specific oral surgery branch.
That is what is different compared to other specialty in dentistry. Every dental college will have good number of, say, decent amount of endo cases, okay number of orthodontic cases, perio, everything you will get. But in oral surgery, that is not the current scenario, at least in India. So there will be some lacunae in your training, and you need to work as an individual to improve in which area you need to work on.
Okay.
Especially if you have interest is there.
Mm-hmm. So now for a fresh oral surgeon who comes out after their post-graduation, what are the different options in front of them after their post-graduation?
Actually, there is a wide array of opportunity for a maxillofacial surgeon. The whole head, neck, face, even the cranium is open for maxillofacial surgery specialty. There are various fellowship programs. The National Association of Oral and Maxillofacial Surgeons have started fellowship programs in oncology, orthognathic surgery, trauma, and now in reconstructive surgery as well. So if a particular candidate feels, say like he is lacking in training in orthognathic surgery, or he is interested for advanced training in orthognathic surgery, he can opt for fellowship programs in orthognathic surgery. Some may be interested in oncology. So they have various fellowship programs, either be part of the Maxillofacial Surgeons National Association or several private associations or colleges have started fellowship programs. So they can look into those options as well. So it is all up to the individual. Say like if candidate is interested in clefts, they have the national fellowship program, international fellowship program. But ultimately, at the end of the day, it is not that like once you come back after the fellowship program, if you don't have the opportunity to do such cases, say like if there are no cleft cases after your fellowship program, then there is no point of that particular person pursuing fellowship program in clefts. That is what I would suggest. So like once you decide that this is one area that you're like, this is your area that you're going to work on, and you have good number of cases, but there is no cleft cases, then there is no point doing a fellowship program in cleft. But it's always good to know that how to go about with the case to always improve your skills. But at the end of the day, you need to have the money, you need to have the growth in your career, you need to have a financial stability, you need to have, so many things play in your choosing a particular area, or what specialty, what area you need to work on.
And how do you decide a fellowship? I mean, I'm sure there may be many fellowship in India. Can you name few important fellowship programs for a fresh oral surgeon? What may be something like which are well known in India?
The one famous one is AMSI, Maxillofacial Surgeons Fellowship Program. The orthognathic and trauma is 1-year residential program, and oncology they have started as 2-year program. Now they have started even in clefts. So this is one good opportunity for a fresh postgraduate student. Then different colleges like they have fellowship programs in implantology. Then they have fellowship programs in reconstructive surgery clefts. So separate private organizations have started fellowship programs, and even international fellowship program. But before going to international fellowship program, I would always suggest the candidate to have some basic exposure in some good reputed institution, so they get to see different aspects and different types of cases. Because fellowship programs abroad, they are all short duration and very difficult to get for a long-term duration. So if you don't have that exposure within, say like for example in oncology or in clefts, if you have not seen good number of cases initially, it will be very difficult for the candidate right up front to go abroad and see the cases and get enough knowledge about it. So as a fresh graduate, it's always good that you get like you go and work in a good reputed institute where there is good number of cases, and see what is happening around, how they go about with the planning and treatment of such cases, and then do a fellowship. And once you do an Indian fellowship program and gain enough hands-on, then go about with the foreign fellowship programs.
And these fellowship program, what you mentioned, how is the selection process? Is it, how do they decide for which student they should? Because I believe there may be limited number of fellowship seats available, so there may be a rigorous selection criteria.
The one for the national fellowship program, they have an entrance exam. Once you clear that entrance exam, you will be shortlisted and you will be called for an interview. And the shortlisted candidates can select. There are, I think, 10 fellowships, 10 or 12 fellowship centers for trauma, similar number of for orthognathic, and few for oncology. So all these candidates will be shortlisted on various specialties, and they will be called for interview. And they can go in and have a few, see the place where they will be spending 1 or 2 years. If they don't like the place or where they are, they can always opt for different centers. So that's how the national fellowship programs work. And then they have the international fellowship program, which is not on entrance. There is no exam based, but it is all based on your CV and your achievements and good recommendation letters. So say like if you have a good mentor and you have a good recommendation letter, and maybe if you're lucky, you'll get into the international fellowship program. But the most of the international fellowship programs will be beneficial if you have a dual degree. So Indian maxillofacial surgery, it's always dentistry post BDS, unlike foreign. So you are always a handicap. But it's not that Indian candidates have not done a foreign fellowship program. That is with regard to International Association of Oral and Maxillofacial Surgery. There are other fellowship programs like FAOCMF, where they give exposure for developing countries candidates. And it's always based on your achievements as well as recommendations. So that is also another arena that a candidate can opt for. But before, as I said, before going for all this international fellowship program, the candidate should have shortlisted, like this is the area that he needs to advance his skill, or this is the area that he needs to improve upon, and have a good exposure from the good center in India. Then he can go and see what is happening and fine-tune his skills.
And does this fellowships award the scholarship, or do they have any fees? What is the general scenario?
The AMSI fellows are paid a stipend. Even the AOCMF fellows, which there are different AOCMF centers all across the globe, they also pay few stipend. But now the disadvantage is they have reduced the tenure. Say like previously there was 8 weeks. Now they have reduced to 4 weeks. So there also they will give you stipend. And even the international association have a good amount of stipend. And there are other centers like in Taiwan where they have cleft and craniofacial for a 1-year program. where you can go in as observer and get in good rapport with the center head and try to get into a 1-year program. That is also an possibility. Even in UK, like you can go in for a short-term fellowship and try to have a good rapport with the clinical head and try to get into some sort of a long-term fellowship program. But all these matters once you have a good exposure in your training or post MDS in a good center.
I'm sure the journey may be maybe some struggle would definitely be there, and it is there in every bench. It is not that you become an endodontist that your life will be very smooth. I'm sure it is there everywhere. What is the journey like? What was your experience after your post graduation? Was it very smooth? Everything went very well, or what are the different struggles you think one has to go, which is okay to mention here, because I'm sure life is not as easy for anyone. What was your milestone in the journey as an oral surgeon or a cleft surgeon in your life?
That's a very good question. I think many of the young postgraduates in maxillofacial surgery, not only maxillofacial, mostly in maxillofacial surgery, unlike the other specialty, will love to hear about. It is not easy. You have very few opportunities, to be frank, but it's always good to be positive and look for opportunities. I spent almost 1 year, basically didn't have any affiliation to any institute, just as an observer in a good reputed center. I was lucky enough to be surrounded by good clinicians who had good number of major surgeries. I used to be with them, see cases, and that was the initial phase. Though they would say there is no point being here just as an observer, you should be looking out for other avenues, because at the end of the day, you need to have the income, the financial thing, which all young graduate or postgraduate is looking for. You will have the financial commitments, all those things. So before you get entangled in all those financial struggles, you make use of all those opportunities and get maximum exposure in whichever area of expertise whichever, be it in orthognathic surgery, be it in onco, be it in clefts, whatever be it. So I was lucky enough to work with two eminent surgeons. In fact, 2-3 eminent surgeons in Thrissur and in and around Kerala. And destiny, as I would say, brought me to clefts because I had very less opportunity in clefts. This is a long story. So I spent a few months in clefts and craniofacial center in Jubilee under eminent surgeon Dr. Edenwala. And then I got a couple of opportunities in clefts in other cities in India. But they would say that it's not a good avenue to explore. You be here and try to learn maximum. So I used to be here as an observer, then go and see orthognathic surgery and other eminent surgeon Varghese Mani. He used to operate a lot of orthognathic surgery and he's still operating. And he's always has opened his doors for any young surgeon to come in and see his cases. And another eminent surgeon is Philip Matthew. All these people were very welcoming and to see their cases. And then at the end of the day, after around 1 year, you need to take your call, whether you need to continue your continuous struggle as an uncertainty phase or you look for a permanent job. So that's when I was deciding it's time to move on. And then I got a job in Hyderabad. In part of one of the dental college as well as a famous clinic chain. And it was like any institute, they will have a probationary period. Then after the end of the probationary period, I was supposed to join them. That's when I got a call from the place I was working as an observer for there is an opening. We would like to have you take up this interview. And then I still remember that call I made and the email I got. I sent the CV, they called me for interview. And it all opened. The door opened and that's how I got into the clefts. So this is what I would like to summarize. You may not be having that exposure in whichever specialty, but destiny might be opening new doors to you. Like in my case, I never knew about clefts, but the path I am now is in all clefts. It's all clefts. I treat children with clefts, babies with clefts. So it's all a new world which I never had an opportunity. So as a young postgraduate, you need to always keep your eyes, ears, minds open. Try to learn whatever you can. You never know which comes in handy in your future.
You have been mentioning about the mentors a lot, throughout your, I'm sure, because we do have a lot of importance in our branches to a mentor. But I think as an oral surgeon, because my brother is a liver transplant surgeon, and I know that how important mentors are, especially for oral surgery. How do you find good mentors? That is something which I want to listen from you. How do you find them?
Because in surgical specialty, there is no room for errors. Of course, as young surgeons, you are always bound to make errors. But when you have good mentors to guide you, you will reduce that errors. Because the sutures you put, the smile you create, that define the future of the babies or the future of the child as an individual, the parents, the whole family. So especially in clefts, there is limited room for errors. So as the mentor, Dr. Edamwala, one of the pioneers in clefts, he would say, it's a long learning curve. I was blessed enough to be under him and learn from him, and also others, eminent cleft surgeons in and around. Because the day you make an error in your, even a slightest error, that will put a bad mark on that child. Even in palate surgery, the speech is a key. So the day how you operate, if you make a fistula in a palate repair, that is the end of the journey for with regard to speech. So unlike other aspect of oral and maxillofacial surgery, of course, even in dentistry, there is always the learning curve. But with regard to oral surgery, it is even more less. And clefts, there is no way you can make an error. So that's where the role of mentors come into play.
But how do you find them? The question is, how do you find them?
You need to have your mind open and willing to spend some time, visit different places. There is not a single day that, or a single place that, or a single surgery that where you would never learn something new. Even you may feel that you might have seen the same thing again and again. You might be learning something new. Different surgeons will be having different techniques. It might be an orthognathic surgery where each person will have different fine tips that you try to incorporate in your armamentarium. You never know when those things come into play. Sometimes when you're operating alone and you go into trouble, maybe that particular thing might come to help you.
Thank you, Dr. Varun, for mentioning about the role of mentors in the growth of an oral surgeon. I also want to know that you have done some certification, from Royal Colleges, which are available in other branches. Can you just throw some light about these certifications?
First thing post MDS I did was International Board Certification. It is an exam conducted by International Association of Oral and Maxillofacial Surgeons. It's a very good exam for any young aspiring maxillofacial surgeons to attend, because it is a board evaluated and it's all across the globe. On an equal platform, you will be evaluating, it will be a benchmark. There will be a one MCQ based exam and a clinical based scenario. That is how the international board exam is. Now they have started international board specific for oncology, and then they are planning for reconstructive surgery as well. Then I did the Royal College of Surgeons exam. First I did the Ireland exam. Ireland is the only college where you need to attempt their own exam, because no other college, they won't accept the other sister college exams. So it is a very prestigious exam, the membership exam by Royal College of Surgeons. Then once you clear that exam, you can attempt the fellowship exam of the Royal College. So these three exams are very prestigious come for a maxillofacial surgeon point of view. When you say once you clear this exam, if there is any added advantage or added opportunity to work in UK or US, that is not there. But it is always good to know where you stand among your peers along the world. So in that way, all these exams matter.
We have listened to your journey. You shared your struggle. I know you are trying to, give the idea regarding the general information or a journey which a fresh oral surgeon has to sail. It has been an amazing podcast listening to you. But what is your concluding remark for the fresh oral surgeons who plan to aspire as an oral surgeon in the field of dentistry or maybe craniofacial or all the vast field of as an oral surgeon?
No matter what your background is, always stay positive. Don't get disheartened by the setbacks. We'll always have setbacks at different point of life, but you try to learn, try to improve knowledge as well as skills. Try to find good mentors who will be helping you, willing to help you in different stages of life. And each day is a new day to learn. Never stop learning. That is what I would say, young, aspiring maxillofacial surgeons, especially. I'm sure it is applicable to all specialties, but for maxillofacial surgeons, especially, it's all up to you to pursue your passion. Keep that passion alive till the very end.
Thank you, Dr. Varun Menon, for giving me your precious time and sharing your experience on Aspire 32. I'm sure if the viewers have any question, they can always mention in the comment section, and do like this video and share this video with your friends if you think it will be helpful to them. Once again, thank you, Dr. Varun, for coming on Aspire 32.
Thank you, Dr. Suresh, for having me here, and keep inspiring all the young as well as colleagues through your YouTube channel. Hope it is beneficial to all the graduates and postgraduates.
See you again with many more podcasts on Aspire 32. Bye for now.